about 5 drugged out people. They've been zombies for the last couple hours.
It's important to make the public aware of what's going on in their city.
He's like passing out, puking up water and screaming.
You hear it called synthetic marijuana. It's nothing like marijuana. We won't even use that term anymore tonight. This is poison. It can make a person violent, sick, or kill them. And if you think it's only a downtown homeless problem, you're wrong. If you think it's not in your neighborhood, you're wrong. And if you think your teens don't know about it, you're wrong. Synthetic drugs are part of schoolyard discussions, and at least one of your kids' classmates has tried it. And the state of Texas doesn't understand the problem.
Football may be his sport of choice, but basketball was what helped Luis Molina get his life back.
I was really just tired of living the life, depending on the substance.
That substance was synthetic drugs, often sold as K2 or Spice. It's the drugs you hear about when rescue efforts from overdoses shut down city streets.
Another unit at 7th and Dutchess.
We're responding to these calls not as just ODs, which would be a little bit simpler, but it could present as a seizure, it could present as abdominal pain, it could present as altered mentation, it could be an assault.
These calls impact you.
They're all over the county.
A person, man, woman, teen, adult, rich, poor.
Possible K2 patient. Do you want him code 1 or code 3?
Code 3.
Synthetic drugs are an Austin epidemic.
Backup demand 1, party 2 overdose, 8th and Nexus.
We found how it can begin at your home.
June the 1st. Yeah, because it was on my birthday when I tried it.
Molina is like any other 17-year-old. Wants to fit in, be liked.
At first, I didn't know what it was.
At 14, he wanted to be accepted by his older friends.
I thought it was just marijuana.
It wasn't marijuana. The chemicals soaked around herbs gave a high, easy to find, cheap to buy.
My grades went on a really down slope.
Ahead of his class in 7th grade to become expelled from 4 schools. And at 15,
almost running over a cop.
On synthetic?
Yes, I had actually, when he put the lights on, I had actually just turned on the blunt.
Molina isn't alone. His story can be found in any Austin district.
They're toxic exposures.
These are confirmed synthetic drug calls taken from Austin Travis County EMS last year. They started tracking when they noticed their resources getting strained. It impacts all emergency care.
So we kind of get ready for a patient who's pretty much out of control.
Synthetic use can turn a person violent.
We have 1 patient here, K2 alert.
We have entire rooms that are basically completely stripped down except for a stretcher, the TVs in the ceiling.
More hospital ER staff must attend to 1 person. Doctors and nurses' safety are at risk, their time consumed, which means your trip to the ER is impacted.
It's very frustrating.
What's more frustrating, he says, is it's not tracked at the state level. That stripped room, the combative patient, extra calls for paramedics. Hospitals don't often test for synthetics because the results take longer than the recovery. The patient is out by the time it comes back.
Our standard toxicologic screen will not pick it up.
None of it alerts the state about a problem with synthetic drugs.
The state of Texas recorded 296 incidents for the entire state last year. And if you look at their data for Travis County, they recorded 94. But these numbers are way off.
So that's why Austin Travis County EMS started tracking for their own records.
First and foremost is a responsibility to the community.
Calls in our area reach into the hundreds every month. In December, it spiked to 339 calls for help. Then in March, it spiked again. These are conservative numbers, only confirmed when someone admits to the drug use.
I mean, we probably have a half dozen cases here on any Friday, Saturday night. The other trauma centers see the same number, and that's just in Austin area alone.
As soon as we wrapped up that interview, another patient on synthetic came in. That patient was combative.
But I see it more as a substitute when they can't get their drug of choice.
At Austin Recovery, a rehab house, counselors see people who don't always call 911. And they tell us the problem with the data is a problem for solutions.
Do you think if we had better data, more accurate data, we would be able to combat it in a more aggressive way?
We would.
This is something that does strike at the heart of our children. If this was any other kind of epidemic, this would be on the map and in everybody's talking points.
Luis beat his addiction last year.
If it wasn't for this place, Phoenix House, you know, I wouldn't be where I'm at today.
He's planning to go to college, then grad school, and come back to counsel others.
You can learn more about how Molina beat his addiction online. We've profiled the Phoenix House Therapy. They're just one of several rehab facilities in Austin. But the long-term solution has to be with our laws, and this is a polarizing subject. So chat with us on social media, email us, or pick up the phone and call us. We need to end this epidemic together. For the KVUE Defenders, Erica Proffer, KVUE News.